Having a knee replacement is not the end of the road for your knee pain. It's the beginning of the recovery process. So a common misconception is that this is a magical cure with robotics and less invasive techniques. I'm going home the same day, so I'm not going to have any pain. That is so wrong. Unfortunately, a knee replacement is a great option, but it does have a painful rehabilitation process. For whatever reason, the knee, after it's been replaced, wants to scar down. Scar tissue in a knee replacement is very damaging, and it's so easy to prevent. You just have to move it a lot. So what does that mean? Well, if you're going home the same day of your surgery, literally the next day, you will be starting a very aggressive physical therapy rehabilitation program on your knee replacement. And what does that involve? Moving it frequently. I recommend that my patients perform therapy on their knee literally every hour while they're awake. Now at night, get rest, because I think that's important for your recovery, is to get sleep as much as you can. But if you're awake 16 hours like the average adult, you need to do therapy on your knee 16 times per day, which is once per hour. And what is it? It's very simple. You go for a warm-up walk of roughly 25 to 50 feet. Number 2 is you sit down in a chair and work on fully straightening your knee. And number 3, you then work on fully bending your knee. This therapy should take roughly 2 minutes every hour. And what you want to try to get is daily progress. You don't have to get full motion out of your knee day 1. But we do want full motion out of your knee by 6 weeks. So every day, make progress, titrate your pain with pain medications, but make progress through the pain to get a good outcome. Preventing scar tissue is the number one thing that you should be doing early on in your knee replacement for the first 6 weeks. So again, not to overstate, a common misconception is I'm not going to have pain with my surgery. Unfortunately, you probably will, and you have to do your therapy despite it. Another misconception is that I can just go about my day with no problems right away. No, some people can go back to work and live their life relatively normally, but if you have a high demand job, if you're doing a lot of running around, chasing things, you're probably gonna have to get help in the immediate period. You won't be able to move like that right away. You do have to rebuild your body a little bit after having your knee replaced. So realize that it isn't a magic wand. There is a rehab process, and you have to carve out 6 to 12 weeks of your life around this knee replacement where you're going to need some help and get your affairs in order beforehand to try to minimize the disruption to your life. And lastly is, even with pain medications, you're not going to have no pain at night. Unfortunately, realize that it's going to be difficult to get sleep, especially that first 1 or 2 weeks. You just have to try to do your best, realize that it's normal and it will get better. Don't let pain run your life. Do the therapy, get rest when you can, and then if you do that, you'll have a great outcome in front of you with a bad memory behind you.